Okay, so I believe we are back in session. I'll just shut the Zoom real quick to make sure. But I'd like to welcome you back to our next session, where we are very fortunate to be joined by John Eyles from Auckland University, the University of Auckland, who will be chairing this session. We have Professor Anne-Laure, who is joining us virtually from Melbourne. We also have Professor James Barlow from the Imperial College of London. And we also have Professor Fujikawa from Hitotsubashi University, who is all of them are deep experts in innovation. And so they'll be diving into the ideas of innovation and value creation that Dr. Senwell will start us off with this morning. So John, I'll turn it over to you and the team.
Thank you, Philip, and thank you for inviting me here today, and welcome everybody. I hope everyone online is able to hear also. The session today, we have a number of questions we're going to look at. I've posted the questions online as well, so I thought maybe it's easy for people to read them. I'm going to kick off by, first of all, just welcoming the panel members and thanking you for being here today. Anne-Laure, it's unfortunate that you're unable to make it, but I hope you're feeling much better there. And next time will be great to have you here as well. So a simple question which I would like all of the panel members to answer before we get into some really nitty-gritty discussions is, looking at this title, Sustainable Future. So my question for the panelists is, you know, we hear the word sustainability used so often these days. It's become almost a throwaway word. But for the panelists, I'd be really curious to know, what does a sustainable future look like to you? And if I could start with James, because James is next to me, if you could give us your vision of what a sustainable future looks like. Okay. And you have only 3 minutes.
Well, I mean, I look at this from the perspective of healthcare, which is the area I've spent the last 25 years working on. For that, I was working in other industries, and actually spent, it's actually 46 years since I first came to Kyoto. So I've had quite a long-standing connection to Japan. But in healthcare, I guess my perspective is that we have this escalating problem of hugely rising demand for healthcare, escalating costs, an aging population, huge needs for basic healthcare still in some parts of the world. And the big question for me in terms of sustainability is how you actually maintain a high quality healthcare system at an affordable price. How we use innovation, whether that's technological innovation or organizational innovation, financial innovation, to achieve that. I don't know how long you want me to.
Well, no, so
that's my starting point.
Yes, no, great. So
I have other words to say. But,
yes.
So I mean, obviously, sustainability is one of those throwaway words which we tend to use widely in all sorts of situations. But just to give it a bit of focus, I'm concentrating specifically on how we meet the world's population's healthcare needs in a sustainable, affordable way in the future.
Wonderful. So in that future, people would be thriving.
Yep.
And there would be great healthcare. Thank you. Yoshi, please, if I could pass to you.
Well, thank you. Just building on what James has just mentioned, sustainability for me is not just for the individuals, but also the organizations. And there's a reason why we actually put this conference in this place of the world where as Senoko-san mentioned earlier, there are a lot of companies. It's actually almost close to 70% of the world, more than 200-year-old companies actually existing in this country. And many of them are actually in Kyoto. In Kyoto, I'm actually originally from Kyoto, and I'm currently living in Tokyo. So I'm kind of reverse version of Sato-san here. When it comes to sustainability, this multi-stakeholder model that we all familiar with as the research on value creation, that we really need to make sure that everybody involved in your effort of the value creation is actually kept to be part of it. And so extension of sample Yoshi, right? It's not just yourself, but everybody else around you also staying happy. And working with you will basically create the sustainability. And that should be applied not just for us as individuals,
Yes,
but anything that we do as the business sector and then other issues. So that's that kind of world I see.
right. So that future is a win-win future. Yeah. And Anne-Laure, I pass the same question to you. I'm not sure where I look at you over there, but please go ahead, your thoughts.
Thanks, John, and very sorry I can't be there in person. I hope next time circumstances will be a bit more fortunate and I will be. And just saying, I'm not sure if it's the same for everyone in the audience, but sometimes the mic might be a bit too distant. I can hear you very well, John, but I wouldn't have said the same for Yoshi. So just maybe something on your end, or if I'm the only one sort of struggling with that, maybe that's not so important, but at least I want to make sure your all audience online is really able to
That's
hear
really
you well.
good to know, because we're kind of flying blind here. So maybe I'll pass my mic to,
This mic?
is it this one? Ah, okay.
Unidirectional mic. As people speak, I think we have to move. Sorry.
Move it around.
The interpreters asked us. Yeah, the interpreters asked us. So this is the Zoom version.
All right. Thank
you.
Back to you with the question.
Yes, and after those practicalities, well, I very much agree that we hear and we use the word sustainability often and probably way too often. And I think the word sustainability is somehow keeping us in a passive mode. It's certainly not calling for bolder action and bolder move and to accelerate the socio-technical transitions that we need to face one of the biggest challenge of humanity. I mean, we're exceeding planetary boundaries at an unprecedented rate, and there's clearly a need to move beyond sustainability and to go towards something that is much more regenerative. So if I would depict a sustainable future, I wouldn't call it sustainable, I would call it regenerative, to have that lens around supporting renewal, but also revitalization and replenishment, obviously of ecosystems, but also communities and economies globally. So I really want to have that shift towards bolder and more empowering action. And I'd like to see futures rather than one future, because I think it's very prescriptive in one way, and I think we need to help and build different types of futures, those that can be accommodating for diversity in our world, so sort of catering for different perspectives, different ways of life, but certainly with a regenerative mindset in view.
Lovely, thank you. So, as you say, extending it to regeneration, not just sustaining what we have, but renewal. And I really like your point around there are multiple futures. We don't know what the future is, and we can create multiple versions of that future, and it's certainly not an extension of the present. What I'm going to do now, for the audience, is I've asked our panelists to share a question that they would like to answer. So I'm going to talk to you again, Anne, there, and then I've also got some interactive questions that follow on from each panelist, and then we'll open it up to a sort of general discussion. So And you didn't give me exactly the question, so I've formulated this. I know you're interested in open innovation and how industry and universities can collaborate together, but I'd be curious to hear from you, please. How do we need to redefine innovation if we're serious about sustainability and inclusive value creation?
Sorry, was that a question for me, or is that a question you're posing to the audience?
It's a question for you, and then there's the question for the audience that follows your conversation.
All right. Okay. So, well, then I think I will very much go down the line of openness, and certainly that logic of open innovation. Open innovation, not only from the perspective of using open innovation models and mechanisms to create financial or monetary value, as it is in a way, unfortunately, usually depicted and described in the literature, but open innovation from the perspective of catering for different needs and also making needs emerge from users or even prospective users. And the second part to the answer would be around regeneration again, and how do we embed aspects of sustainability, but with a more proactive sense. So really looking at resilience, looking at restoration, looking at regeneration and renewal of ecosystems and societies, and taking a very inclusive lens. By adopting open innovation principles, you can't dismiss the inclusive perspective, but obviously you could put more or less emphasis on it depending on which stakeholders you involve more in your innovation process.
Thank you so much. And now I'm going to pose your question to the audience, and we're using Mentimeter. So if you would like to get out your mobile phones, please. The fastest way is to scan the QR code. Alternatively, you could put in the URL and use the code. So I'll just give you a moment to log in, and then I'll present the first question to you, and then maybe we can ask the panel to make some further comments. If I can just get a sense from the room, how many of you are already in there? Okay, yeah, getting there. You'll only do this once for all the questions. So once you're logged in, we'll be good to go. If you're struggling, talk to your partner next to you, introduce yourself and use their phone as a means. All right, and those at home, of course, can do this also. So when you log in, you should see this, and I'm going to turn it now to the first question, which is, do I need to go back? There's a code on the top there as well of the screen. I don't know if you can see that. Would you like me to go back? Because this, if we get this right now, then we don't have to do it again as we move through. All right, what do they say in weddings? Speak now or forever hold your peace. So yes, think about an innovation that's generated value beyond profit for you or for your community. It might be something that you've done, or it's something that you've watched others do, and things happening. COVID vaccines, large language models. I don't know what WWS stands for, but James, can you enlighten me? No, okay, that's all right. Obviously, it's created some value beyond profit. Email. And whilst these are popping up, and I'm wondering whether James and Yoshi would like to comment, maybe build on what Anne has said or what you're seeing in terms of the value of these things.
Well, it's quite a mixed bag, isn't it? I mean, these are all clearly developments that are massively valuable for the common good. I guess some of these are, I mean, how many of these will have been created by private companies, innovations, compared to sort of broader public research? I'm just wondering, looking at the list.
The wheel, I know that archaeologically it says used to make pots, not to dry.
I think another thing I'd say about this is that, and you see this quite a lot with innovations, they're created for one purpose, but then you find they have other benefits as well. And there's a lot of latent, unlocked value in many innovations, which which needs to be brought out. I've been doing some work recently on repurposing older drugs for new uses. And we don't realize how much value is actually locked up in existing medicines, existing drugs that has potentially huge benefit, but for whatever reason, businesses or governments or public research organizations don't see that. So there's quite a lot of discussion now about unlocking that latent value.
Interesting.
And I think COVID vaccines being one, actually, where quite a lot of the development for COVID vaccines was carried on without any thoughts about COVID in mind.
Great. So value beyond the initial those unintended
initial purpose. Yeah.
Yoshi.
Yeah. So Anne earlier mentioned about the open innovation, right? And then so many of these innovations that you're asking through this question, that can you name names in terms of innovations that go beyond the profit? The open innovation almost like by definition, like going to go beyond the profit, because the whole innovation process is value co-creation, right? You open up your organizations and invite many of the different stakeholders to play a very important role of creating value together, which goes into the innovation. And so I think open innovation and then this innovations go beyond the profit actually go almost hand in hand to me. So that's how I see that.
Lovely. And if you can still hear me, I'll raise my voice a little bit. This was a question that you had shared. Any thoughts on what you're seeing here?
I think it's really interesting. We don't hear anything on, for example, social innovations. I was hoping for example from your communities. It could be an app that prevents food waste from events, to make it very topical for your context. I'm sure you've planned a lot of food, and you might want to make sure none of that goes to waste. So I was thinking of examples like that. It's amazing to see how rich the list of innovations you've come up with is. But yeah, I'm hoping maybe for some of those to be really contextualized to your community.
Lovely, thank you. And I'm aware that time, of course, marches on. And what I'd like to do now is to turn to Yoshi and really to ask you to maybe elaborate a little bit more around those stakeholder sides of things.
Yeah, so this is actually the question I have, rather than I having an answer to, which I would like to invite everybody to join this discussion, that I see these fundamental challenges between innovation that we want to pursue versus the stakeholder engagement, which we want to invite, right, to co-create value together with. And because the fundamental tension here is the more stakeholders that you want to invite, there's potential kind of slowing down innovation. And because it takes a lot of coordination and an effort that you need to put for inviting the different stakeholders to be part of it. And so how can we best balance that slowing down innovation versus more of the wider involvement of the stakeholders? And so this is I think it's a huge challenge, especially when it comes to social innovations and others. So for example, like, if you look around the world, in which country are at this point, as of now, that has been already practicing, let's say, autonomous driving, taxi, let's say, right? That we have been talking a lot about that. And we don't even have to go to that far. Like, let's talk about, like, rideshare, Uber, or like an Airbnb, like, the sharing economy, that how slow we are as a country, as Japan, for example, because we need to cater to so many different voices. And when it comes to healthcare, that we are living in the aging society. So there's a voice of the older generations is always being heard, versus the younger generation's voice are not necessarily being heard all the time. So sometimes that you may want to listen to specific stakeholders to push the innovation forward, versus trying to listen to the wider audience. Going back to what the Semoto-san was saying earlier, believing in yourself and then ignore the doubters. Sometimes those stakeholders might include the doubters, right? And so how we could balance that.
Yeah, it's a really good question. I mean, there's something going on at my university, and there's a very inclusive process. But this inclusive process is slowing down, and it's that balance, isn't it? I mean, if you kind of growth is reliant on momentum, but if there are more constraints than there is momentum, then you don't get progress. I'm going to ask your question now to the audience, and then we can have a bit more feedback.
Just wanted to respond.
Yes.
I mean, I think this is a hugely important question. And as you say, I think getting that balance between engagement with people, users, stakeholders, and innovation and the innovation process is something everybody's struggling with. Certainly when in the healthcare sector, where there are safety considerations and equity considerations involved in many technological developments in healthcare. There's always this tension, I think, between how much regulation, how much engagement with end users, whether they're patients, families, medical professionals, and how much innovation, So, as I said, I've spent 25 years working on innovation in the healthcare sector, and I've sort of wavered between, on the one hand, saying there's far too much regulation, and actually we just need to do things, and there's too much emphasis on evidence and very, very, very rigorous trials for situations where actually they're not warranted. On the one hand, on the other hand, obviously we do need some controls as well. So I think, and this is not just healthcare, this cuts across, well, certainly large language models, AI, autonomous driving. I mean, all those issues I think are being wrestled with by regulators and governments now, with no real answer.
I was going to say,
the pace of technological innovation is far outstripping the speed at which regulators can actually keep up and governments can keep up.
And I suppose ethics too.
And ethics as well. So I think this is not just a question for Japan, but a very familiar one in Europe and elsewhere.
Fascinating. Anne-Laure, did you want to add a comment here on this before we move to the audience?
Yeah, I think I couldn't agree more with James. And I personally have done more research in the financial sector and financial innovation. And in that context, we've seen, for example, regulatory sandboxes emerging here and there in the last decade. And in a way, they've had a very dual purpose of fostering innovation rather than stifling or slowing the innovation process, but also educating regulators, which is probably the best way to then come to a form of consensus on how the innovation can be adopted at a decent pace, but at the same time without triggering any systemic risk or unbalance in a broader system. And obviously that's even probably more important in the healthcare sector. And just maybe to comment on the question as well around that inclusiveness with the need to innovate quickly, I would also sometimes challenge the need to be that quick. We know from surveys, from statistics, that 90% of innovation fail, and there's probably many unaccounted for. So sometimes it's probably better to thoroughly think through the process and involve stakeholders early on to then be able to accelerate adoption and of course avoid failures of innovations.
Thank you. And I'm just thinking, yes, I mean, the kind of current government in America, this sort of approach is move fast and break things. And if they're really important, they'll get fixed back up again.
They're taking risks.
They're taking high risk.
Yes.
And those unintended consequences are uncertain. So Yoshi has posed a question for the audience. Again, you should be able to use your phone. This should be showing up on your phone. If you've lost the login at the top, you can see the code there. The question is, how prepared is your organization to manage the trade-off between inclusiveness and speed in innovation? Do you take the Nike just do it, or do you? It's a balance, isn't it? I mean, you know, do you have to work it all out to the finest thing before you say go?
Yes.
I think that, like, innovations over the last 2 years have meant we can include more voices and speed up our collection and synthesizing of all the results. So it's actually a really exciting time to think.
Here's an example, isn't it?
Including the community and including people.
Yes.
And getting there. And a lot of the time the community just wants to listen to anyway, actually.
Yes.
For the results.
Yes.
I mean, it depends, but being listened to gives them a feeling. And I think it's just a really exciting time for collaboration.
Yeah, good point. So somewhere in the middle from what we're saying. And you've probably found this in healthcare. I mean, in terms of bringing people in, they're not being paid you're being paid to do your research. They're kind of coming in, and if they don't see themselves then reflected, or they don't get anything back, maybe they're a little despondent.
I think there's too much of that. I mean, I don't misunderstand me. I don't think you should be moving fast and breaking things all the time. But I do think, so if you just take the United Kingdom, for the last 15, 20 years, there's been a huge emphasis on bringing the voice of patients and individuals into decision-making in healthcare, which is a good thing. And but the problem, I think, is that a lot of the consultation is responded to simply by people who have the loudest voices and who are the ones who are just prepared to get their opinions across, and you're not necessarily listening to the voice of everybody. And it does slow things down, I think. There's actually probably too much consultation in healthcare. But often we know what we need to do to make things better in a particular aspect of healthcare. We know how it should be reorganized, how processes should change, where technology can help. And actually, you know, you should just do it and not spend a huge amount of time listening to the voice of everybody. Obviously, if it's a safety critical change, then that's another matter. But most innovation that's needed in healthcare isn't like that. It's actually doing the simple things that we know we need to do to improve processes, to improve ultimately the value delivered by that particular process in healthcare. And we should just be doing it. I'll save my powder dry for later on. So there's some things to say about technological innovation as well. But
do you have your hand up there for a question, or?
Well, that's a question. Okay,
Yeah.
I just want to about healthcare. I'm working in the healthcare area, medical device, and I just there's kind of a lot of people believe that there should be revolutionary change in healthcare or revolutionary change in medical technology and so forth. But there's also very strong, I think, strong argument for constant incrementalization, constant incremental improvement. And just going to your point, we don't need to have the voice of everyone to make an obvious incremental change, which over time will have huge benefit to the system and to the patients and society. That's maybe a slightly off-topic comment, but I think that this is something to think about in innovation. Can we be incrementalists while maintaining the primary thing in the medical device field is safety? That's the primary concern, not efficacy, but safety. So I wonder if there can be a strong argument for constant incrementalism in our innovation. That's my lead question.
I mean, I don't want this to be just about healthcare.
But
but I mean, just very briefly, I mean, I think there's no prospect for tearing up health systems and starting again. So everything is incremental in healthcare. We have a legacy of institutions, organizations, which are very difficult to change. So incremental change is where it's at.
Yeah, and we've a rich conversation around transformational versus incremental. But I'm going to move on back to James, really, in your question here. How is healthcare embracing new perspectives on value?
I think there was another question.
Oh, was there?
Actually, yeah.
Would it be possible to leave? I'm going to open the floor at the end. And I think we're almost kind of through this structured bit, and then we can open it up. I would just be fearful that we don't kind of allow James to have his, as everyone else has had at the stage. So, okay. 5 more minutes.
Right. Well, I mean, I've said quite a lot of what I was going to say anyway, but I think the couple of points I wanted to make in my sort of this bit was really value in healthcare has traditionally been seen very much in financial terms. So in terms of cost savings, financial efficiency of processes and so on, and measured by, some form of definition of outcomes divided by the cost, however you measure that. And things are changing. In the 25 years or so that I've been working on innovation in healthcare, certainly there's been an increasing emphasis on broader definitions of cost. So incorporating, environmental sustainability, costs for all stakeholders, all organizations involved, and not just, the hospital, for example. And there's also been a shift in how we define value. Much broader definitions of value coming in around quality of life, meeting the expectations of patients and their families, wider range of clinical outcomes and so on. So I think things are changing in healthcare, and we are shifting towards a more holistic approach to value and how you measure it. Parallel to all this, there's also been a shift towards what's known as value-based healthcare, which came in about 20 years ago as a concept, which was really just a response to the escalating costs of healthcare systems. And how do we extract better value out of all the innovation that's washing around in healthcare? It's proved incredibly hard to introduce for various reasons, not least because different stakeholders in healthcare all have different perspectives on what value means and how they prioritize different measures of value. And also because it's extremely difficult to measure, collect reliable data on outcomes and link those to costs. Healthcare is absolutely awash with data. There's vast quantities of data, but it's all in silos. There's no interoperability between different healthcare data systems and so on. So whilst we can potentially move towards much more sophisticated value-based approaches in healthcare, it's proving very, very difficult. And the most expensive hospital in the world, Karolinska in Stockholm, which was opened a few years ago, was built entirely around value-based healthcare principles. So they redesigned all the processes and tried to put in place measurement systems and physically designed the infrastructure around that. And that's all kind of rowing back rapidly from that now because it's just been too difficult to put in place. So healthcare is going in the right direction, I think. We are having much more sophisticated conversations about value, but it's hard. The last thing I wanted to say was really about this paradox between technological innovation and the pace of scientific evolution in healthcare and value. And the problem in healthcare is that the paradox is that the better it becomes, the more we want it. So costs never go down in healthcare. So technological innovation is great. You know, it can extend people's life expectancy, treat populations who previously couldn't be treated, deal with, you know, operating on people who are 100 years old, you know, who've never been previously operated on. But costs keep going up because of that. Demand keeps going up. And the technologies, the innovations themselves, you know, we're now faced with innovations that are potentially incredibly beneficial for rare diseases, for example, but cost $1 million, you know, $2 million per treatment. So how do you pay for those? And we simply don't have the health economic assessment tools now to cope with the way the world is changing, the escalating cost of innovations and this problem of ever increasing societal costs of healthcare. So, you know, I guess to sum up, yes, we have much more sophisticated discussions about value, but technological innovation is throwing up new paradoxes, new challenges, I think, which we will inevitably need to deal with.
Thank you. And maybe just Yoshi, I don't know if you want to jam off that a little bit.
No, I cannot agree more on that. What you're saying, James, is basically ratcheted up, right? Whatever the innovation you come up with, that also elevate what they are end users are expected to get. And so the costs just keep increasing, which is actually intensifying in country like here, the super aged society versus aged society and aging society. That they are now, the people 65-year-old and older is now 1/3 of this population of this country, which means that we only have 2 younger generation people to support 1 senior citizen, whereas OECD average right now is 4:1. But in 2050, entire OECD country is going to become just like us, 2:1. And then by then, this country is going to become 1:1. And so the cost of keeping this system going, that we just keep needing these innovations, making it more efficient and cost benefit wise making sense. And we cannot just stop, I mean, doing this. But at the same time, inherently just cost is just going up forever, right? And so how we could push this effort forward is actually very, very relevant and definitely possible.
And of course, to say 65 is not old, of course.
It's true. Anne, anything that you'd like to add or kind of go slightly tangentially off this?
Well, I think I couldn't agree more with everything that's been said before, and there's clearly a huge need for technological innovation, but also for different models of providing care. On top of aging or age or super age populations, we also have a shortfall of something like 11 million workers in healthcare, and we've got increasing number of burnouts and mental forms of distress with healthcare workers. So technology has to be embedded in what we do, but obviously in an ethical way, to be able to shift towards more preventative care and different ways of organizing the delivery of care.
Just something was just triggered in my mind when Yoshi was speaking about disruptive innovation and Clayton Christensen, and the idea that actually cheaper, simpler solutions are often can deliver huge value. But you know, that's something we perhaps don't talk enough.
Just think about washing hands, the difference that makes to health outcomes. We could talk around this for a long time, and I'm thinking of, you know, like education, which is sort of almost the size of health. So it's sort of $10 billion spend a year, you know, it's facing similar challenges. I'm going to pose James's question to the audience, and then we'll open the floor. What are the top 3 challenges in your country, for those particularly online, that mean we need to rethink how we provide healthcare? Certainly in New Zealand, we have a massive problem with obesity, particularly within our Pacific and indigenous populations. Pacific communities, it's around 60+%, and that's crippling healthcare. But I'd be interested to see what others consider are those grand challenges, and then maybe we can have just an open floor discussion on this. Cost and privilege really comes with that, doesn't it? Actually, James, just a thought, saying that investing in preventive. I mean, some people say we have a sick care system, not a healthcare system, and that we should be looking more at well care. Is that a shift that you see?
Yeah, I think very much so. Yes, I mean, and it, you know, cuts across a lot of this. So obesity, not least obesity, where we do have to rethink. I mean, it's not just a healthcare problem. A lot of these issues are societal issues. They're about, you know, access to cheap, affordable, good quality food, for example, mobility, transport, you know, getting people moving, education. So really, it's not about health care. It's about education. It's about having a holistic view around well-being and just, you know, the evolution of our societies.
Thank you. So we have 10 minutes left. So what I'd like to do is to invite the audience online. I don't know if there's chat where a question could go. And so, you know, you can address it to the whole panel or someone in, you know, specifically. There was a question. Oh, yes. Who was it? Who was waiting to ask? Yes, sorry. Yeah.
Thank you. Thank you, and Nicola from Global Perspectives. Builds a little bit to what Phil was addressing, but in a broader sense. We use the term about innovation. I wonder if we consider that creating value stems from addressing a need or a want, whether known or unknown. And then if we consider that, to what degree is there actually a greater need to really understand the problems first, and then from the problems identifying creative applications or combinations of existing and emerging innovations to then solve those problems, as opposed to this need to like continually innovating without saying, well, why are we innovating? You know. Does that make sense?
So you're saying, so is this around innovating without purpose versus innovating with purpose?
It's about create, yeah, it's not in the innovations. Innovations are coming up all the time. It's about looking at the innovations coming out and actually adapting and creatively applying and implementing rather than this drive to continually innovate.
Okay, so yeah, so that when people say there's two I's in innovation, ideation and implementation. It's the implementation part, is it? So pass it to Yoshi, maybe.
I think what you're getting at is the difference between invention and innovation. And invention is just a pure pursuit of the scientific development, of technological development, if you will, versus innovations, as you mentioned, that has to be applied and creating value and for the different stakeholders in society. So it's becoming something useful and then also being adopted by the stakeholders in society. That's how I see the difference. And then I think that the way that we use the term innovation is more the latter, that it's not just for the sake of technological or scientific development, but it's more for social value. That's how I see it.
Comment?
Hello, my name is Nicola. I think the question, I understood the question differently. I think it was more going towards the root cause of the problem. So you might say we might have fantastic innovation, let's say, on how to treat obesity, diabetes, but we might need innovation on nutrition and education to basically prevent becoming sick, so that you don't need innovation at expensive treatments, which are required later. So this is how it is.
And Anne-Laure, do you have anything to add to this?
Not at this point.
Okay, lovely. Another question from the floor.
Hi, my name is Teresa. Just a quick thought that sparked during the discussion, and I just want to maybe hear your opinion about this. I was wondering how sustainable it can really be, because you already also mentioned increasing life expectancy. Like, how sustainable can this be if we are kind of focusing also on increasing life expectancy for the future of the whole society? Because if the people are getting older and always getting older, and there are not so many new generations coming, how can this work in the future? I don't know. Makes sense to understand.
I understand what you're saying. I mean, the question is, what's the quality of life? It's not how many years you live. It's how many years do you have of high quality life, I think. And just simply through technological innovation, extending people's number of years people live, but without the quality is no benefit at all. So I think there are some very fundamental questions about what our expectations are. What value do we place on a long life and a healthy life, and how much are we as a society prepared to pay for that? And then what do we need to put in place to achieve whatever it is we want collectively? Simply doing more and more scientific research, which generates innovations which are not necessarily benefiting people in terms of their quality of life, is, I think it's not the way we should be going at all.
Okay. I think we probably have time for. I saw a hand up over here, and I'm a little bit biased because I'm looking this way, so let's move.
Okay, yes, thank you. Kenzie from Yoshinori University. Speaking to your comments and questions around inclusivity versus innovation, where do you see the biggest pushback when it comes to that issue? Is it during creation or is it during the implementation process? So is there, maybe in Japan, in your experience, is there an issue with people wanting to innovate within their companies or innovate within entrepreneurship? Or is it they want to actually innovate, but then when it comes to implementation, they're getting pushback from those shareholders? Like, what are you seeing biggest?
The way that I see it is more about implementation. I see it that when it comes to bringing the new ideas into practice, that the way that they get the reactions from the different stakeholders, not necessarily always welcoming, right? And so I think the implementation is the bigger challenge, as I see it.
And thank you. And I'm sorry, Trevor, is it that? Could you save your question, ask it directly afterwards, because we're almost at the end. And I just have one last question for Anne-Laure there in Australia. And for each of our audience members, just a quick final wrap up. What's one myth about innovation we need to let go of? And I'm sorry, I put you on the spot here.
Definitely, that was unexpected. Well, but I probably would want to build on what was said before. And maybe one myth is that every single innovation is socially desirable, and clearly not all are, and need to be framed within context, within ethical boundaries, within perspectives and purpose and intent of what kind of problem they want to solve or what kind of solution they want to bring, sometimes to an unformulated problem yet. So it's really that perspective that not everything is socially and maybe societally desirable.
Thank you. Thank you.
Well, I mean, following on from that, I think it's the myth that every problem needs an innovation. Usually, I think simple solutions are probably and things that we know we ought to be doing actually and we just need to implement them. That's what we need to do rather than come up with some.
Do the simple
first.
Boring but effective.
Simple, boring. Maybe it's not what shareholders want to hear or politicians, but simple, boring, and just implement it.
Yeah.
Well, I see this question very similar to when we ask the myth about the creativity, that we often said, I'm not creative, and just let those creative people to take care of the creativity. But when it comes to innovations, then anyone can become the innovator, because the definition of innovation is just new combination of something already existing, right? So anyone, any one of us can innovate. And so, because when it comes to combining, going back to these incremental innovations and disruptive innovations, and sometimes, in many cases actually, the great innovations are the ones that are very, very simple and easier to adopt, and not really require that much of the grandiose ideas. And so that could actually solve a lot of issues in society. So that could be one myth.
So thank you very much, and thank you to all of the panelists. Anne-Laure there, thank you. James, thank you. Yoshi, thank you, and to the audience, thank you. We will be having a break as just 5 minutes, but this conference is going on tomorrow as well. So I'm sure Yoshi, James will be very happy to take over questions over tea. So thank you very much.
Great, thank you all very much. And Laura, thank you for joining from so far.
Thank you, it's been a pleasure.
Right now, I believe we still have a breakout room. I don't know if there's any more coffee left. There's a little bit of coffee, if you'd like, but we'll be back here. We've only got about 5 minutes. And then we'll start off with our next. So thank you all very much.
Thank you. Discussion.
Thank you.
Thank you, guys.
Thank you.
Yes. This is
hard to get.
You never know where these things are going to go.
Hard to get a lot in a small.
Yeah, I think we did actually get a huge. Yeah.